a seven-fold increase in reporter activity. And the heat shock, the way the heat shock is given is that cells are put at 42 degrees for 30 minutes, and then in this case we're allowing a period of recovery back at 37 degrees for 4 hours. And the HSP90 inhibitor was added 2 hours before the heat shock. So we did a chromatin immunoprecipitation experiment, otherwise known as CHIP, using antibodies to HSF1 to look at HSF1 binding to DNA. And what the HSF1 is going to be binding to are those same elements as we were looking at in the promoter to HSP70. So these are elements that recruit HSF1 to promoters that are sensitive to its transcriptional activation. And the readout here is we PCR the amount of the promoter that we're able to pull down with antibody to HSF1. And basically, if you just look at the graph on the bottom, you can see that for two promoters, the HSP70 promoter and to a lesser extent the HSP90 promoter, if you just heat shock the cells, and that's the no drug group, N is no heat shock, and those numbers are set at 1. You can see that there's an increase in HSF1 binding to the promoters at 5 minutes after heat shock is over, so recovery time of 5 minutes. But by 2 hours, the amount of HSF1 binding goes below baseline and stays there for the remainder of the experiment, which is a recovery of 6 hours at 37. In contrast, if you add the HSP90 inhibitor for 2 hours prior to the heat shock and then do the same recovery experiment, you can see that even in the absence of heat shock, HSF1 bound to the promoters for 70 and 90 are as elevated as they are in the no drug groups after heat shock. So 17-AHE is causing an increase in HSF1 occupancy of promoters in the DNA. And the other thing I would argue from these data, if you look at the 17-AHE group, is that HSF1 binding to these promoter regions is retained for much longer if you add in drug to the heat shock than you see with just heat shock alone. So even at 4 hours, the levels are, at least for HSP70, above the baseline. And this is counter to what we see in the no drug group. So our model is that HSP90 inhibitors actually block HSF1 dissociation from DNA, which is mediated by HSP90 alpha, as sort of a feedback control on turning off the heat shock response. HSP90 inhibitors prevent HSP90 alpha from coming on and pulling the HSF1 off, and so its occupancy on the promoter is therefore much longer and to a higher extent. And when other factors that are important for driving HSF1 transcription are present, you get increased transcription for a significantly longer amount of time. And we think that's what HSP90 inhibitors are doing. Now, as it happens, we've also been working with HSP70, which is also known to interact with HSF1. And we found that an HSP70 inhibitor seems to block this ability of the HSP90 inhibitor to augment the reporter activity you see after heat shock. So the 17-AHE plus JG98, which is the HSP90 inhibitor, is shown in purple on the slide compared to 17-AHE and heat shock alone, which is the red line. You can see it's almost completely suppressed. The 70 inhibitor suppresses the heat shock response by itself. So it isn't anything specific to 17-AG, and it's probably happening before HSF1 ever gets to the nucleus. If you do a chip experiment, in this case with JG98, you in fact find data that confirm this hypothesis. So no drug, just heat shock on the left versus JG98 plus heat shock on the right. And you can see that the amount of HSF1 bound to chromatin after heat shock is markedly suppressed. Complete opposite of what an HSP90 inhibitor would do. And in fact, if you combine the two agents, 90 inhibitor and 70 inhibitor, and now we're looking at a Western blot of HSP70 protein, as well as the very sensitive HSP90 client, ERB2 or HER2. In the panels on the left, you can see with HSP90 inhibitor alone, reduction in ERB2 expression, but activation of HSP70, increase in HSP70 levels. On the panel on the right, if you include an HSP70 inhibitor with the HSP90 inhibitor, you still get reduction in the HSP90 client HER2, but now you significantly blunt the increase in HSP70 protein consistent with the chip data and the reporter information that I showed you in the previous slide. So we're thinking that a combination of this HSP70 inhibitor, which we've already used in vivo and has anti-tumor activity as a single agent, but hasn't progressed past a few animal experiments yet. But combination of this inhibitor with an HSP90 inhibitor may allow for retention of the HSP90 inhibitor effect on its clients, but prevent this counterintuitive effect on HSF1, which we would very much like to see. The last few minutes, I just want to get back to the newest trial using an HSP90 inhibitor, which was the red top part of that last bar in one of the early slides. This trial has just actually opened here at NCI. There are only a few patients currently involved, but it's based on some very interesting data we got in collaboration with Lee Hellman and Christine Hesty in the pediatric branch at NCI. And that's using a property of HSP90 inhibitors that are true for HSP90 inhibitors as a class. All N-terminal HSP90 inhibitors have the property of being concentrated in tumors compared to normal cells, and for remaining in tumors for a significant amount of time compared to their normal half-life in normal tissues and blood. So they can remain at high levels in tumors, depending on the inhibitor, anywhere from 2 to 4 days after they're completely gone from the circulation. So the folks at a biotech called Synta decided to use this property of HSP90 inhibitors to deliver a payload which in general would be a cytotoxic agent that would have significant systemic toxicity or systemic instability. And the first agent they chose to examine was the active metabolite of irinotecan, which is structurally shown on the right, along with the HSP90 inhibitor. Irinotecan is a topoisomerase inhibitor, and it's used to treat. So what it does is it prevents the repair of DNA strand breaks, and is generally used in conjunction with a DNA damaging drug, or in a cancer that's aneuploid and genetically unstable to begin with. It causes a lot of DNA, of the inability to repair the DNA, and a lot of replicative stress. So this agent is coupled to the HSP90 inhibitor through a cleavable linker, and then it's administered to, in our case, animals with Ewing sarcoma, xenografts, and rhabdomyosarcomas. These are pediatric sarcomas that are treated here at NCI. And I'm not going to belabor the point, but the bottom line is there's a dose-dependent, clear, efficacious effect of these conjugates, and the conjugates termed STA8666. So the orange lines, the light blue lines, and the gray lines, compared to irinotecan alone, which is the purple line, and the HSP90 inhibitor alone, which is the red line. So in these models, HSP90 inhibitor alone does almost nothing. Irinotecan always gives you a very dramatic response. This is true in these mice, but it's also true in patients. But invariably, tumors grow back and they become resistant to irinotecan. And that's also shown in these models. However, when mice receive 2 to 4 injections of this conjugate of the active metabolite of irinotecan coupled to the HSP90 inhibitor, we could achieve doses, especially in the Ewing's model shown in B above in the slide there, where you could get complete regression of the tumor, and the tumors essentially never came back. And the ones that did come back, if you retreated, they would go away again and stay away for another extended amount of time. Those arrows show how frequently we inject the drug. So the drug is given once a week. And in the case of the Ewing's model, we gave 2 weekly injections, and that was it. And these tumors are quite large if you look at the size numbers on the y-axis. The rhabdomyosarcomas also show a dose-dependent effect, but it's not as durable as the Ewing sarcoma. And if you look at survival, you can see that as well, especially in the overall survival in the panel on the lower right-hand side, which is the Ewing's model, with the highest dose of conjugate, which is achievable in people. There's essentially 90% survival over about 2/3 of a year. And these data actually were instrumental in initiating the clinical trial that's just open. This is another model of Ewing sarcoma. This is a PDX that never saw irinotecan before. And you can see that while irinotecan is effective in this model, you get what look like complete regressions in the purple line. The tumors invariably regrow. But in the case of the conjugate, they never regrow. And in this case, survival at 200 days is 100%. And I can skip that. This is the trial, which is in clinicaltrials.gov. And with that, I'll stop and acknowledge these people in my lab, elsewhere in NCI, and at Cinta for collaborations and for doing the work. And happy to answer any questions. HSP70 is probably the chaperone that actually sequesters HSF1 in the cytoplasm. People thought it was HSP90. It's probably HSP70. So the HSP70 inhibitors actually end up destabilizing the HSF1 as protomers, and so they never get to trimerize and get into the nucleus in the first place. In terms of HSP90, yeah, the model is that in the presence of ATP, HSP90 will go through this conformational change, latch on to the HSF1, and then as the consequence of ATP hydrolysis, pull HSF1 off of the DNA. What the HSP90 inhibitors do is they displace ATP from the binding pocket because they have much greater affinity than does ATP. The dimerized HSP90 now opens up again, and it just falls off of HSF1, and so HSF1 is allowed to remain on the DNA for much longer. Yes, there's some sold as such. They may or may not be specific, and they're not particularly potent. No, it's likely this HSP70 inhibitor will be in the clinic first as a single agent. And depending on how that looks, it's difficult to do a clinical trial where you're combining two unapproved drugs. So I mean, one of those two would have to get approved before we could combine them. Or if there were an HSF1 inhibitor that got through the clinic and was approved, we could use that, but those don't exist. So there's a ways to go, but we have the beginnings of a potential solution for this problem.